Hey, Dr. Jerry Williams here with Urgent Care 24/7, here to talk to you about toothaches. And no, I am not a dentist. I'm a people doctor, I'm a medical doctor, but I am the founder and owner of Urgent Care 24/7s and also am the founder of Dental Care 24/7. And we see a lot of dental emergencies and a very common problem, and I want to talk to you about how to best to handle it. First of all, if you're watching this video, you're probably in that situation where you or a loved one has a toothache. And I'm really sorry, so I hope this is helpful. First thing we need to do is assess the situation and try to find out the etiology or the cause of the pain. Is it an infection? Is it from an abscess, for example? Or is there just a cracked tooth? Because sometimes trauma can cause it. Be either from biting down on something hard, like an olive pit is a common thing where people are eating a salad that has an olive in it that's not supposed to have a pit still on the olive, and they bite down on it and actually fracture or break the tooth. Or is it from neglect, where they've got cavities, they've got decay of the tooth itself, and subsequent infection. So there's lots of causes of tooth pain. But so if you're having a toothache, it's really important that we get your pain under control. And one of the things you can do is use topical lidocaine and apply it to the base of the tooth. And if you can just get lidocaine gel that can be used orally, or a gel, or those kinds of topical anesthetics that are made for dental pain, and apply it right at the base of the tooth, right where it's hurting the most, that can be helpful. Also, taking ibuprofen or naproxen sodium or Tylenol, acetaminophen, I should say, those can also be extremely helpful. But it's going to be really important you get to the dentist right away so they can do an x-ray or an examination, an x-ray, and see what's going on in there. Is it a fractured tooth? Is it an infection? Because an infection, you're going to need to get on antibiotics right away to help clean that infection up, clear that infection up, and hopefully save the tooth. So if you're having a toothache, look for the acetaminophen, which is an analgesic to take by mouth, a non-steroidal such as ibuprofen or naproxen sodium, and the topical anesthetics that you can apply right to the base of the tooth where the pain's coming from, and then get to your closest medical care, or preferably dental care. If you can't find a dentist who can see you right away, you can do a telehealth visit. And you can certainly find a medical provider who can call on a prescription, and you can take over-the-counter pain medications for pain. And if you are having a lot of pain, you need to go get seen right away, either by an emergency dentist or a dentist who's willing to see you after hours if it's not during regular hours, or get seen at an urgent care center, or as a last resort, an emergency room. I hope this is helpful. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe. And when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.